Dr. Ferrer, the floor is yours.
Good evening. I'm Barbara Ferrer, Director of the Department of Public Health, and I want to thank all of you for joining us here for this virtual town hall on the COVID-19 vaccine. Buenas noches a todos. There have been many new developments since we last met a little more than a month ago. Our panelists will go into more detail shortly, but in just the last month, the Department of Public Health has implemented the initial requirements for vaccine verification at bars, breweries, and wineries. The FDA and CDC approved boosters for the Moderna and Johnson & Johnson vaccines, along with the Pfizer vaccine. And just this week, the FDA Advisory Committee recommended that children ages 5 to 11 receive the Pfizer vaccine. With so much going on, we wanted to share as much information as possible since we know there are many questions. I'm very happy to be joined by my colleagues from the Department of Public Health, Dr. Muntu Davis, Los Angeles County Health Officer, Dr. Sarah Kurian, the Interim Regional Health Officer for the Department of Public Health, Dr. Nava Yagane, a physician with the Department of Public Health, and Gemma Morales Meyer, the Director of Clinical Services with the Department of Public Health. To start, I want to tell you a little bit about how the town hall will go tonight. We'll start with some brief remarks from each of our panelists, and then we'll spend the rest of our time answering your questions. And as a reminder, you can send in your questions in the chat on YouTube, Facebook, or Twitter. Although all of our metrics continue to decrease slightly, the rate of decrease has slowed significantly, suggesting that we've reached a plateau in transmission. We really only saw minor decreases in our case rates over the past few weeks, leaving us with a case rate of about 72 new cases per 100,000 residents, which reflects continued substantial transmission all across the county. Given that there still is considerable transmission, along with the risk that changing conditions favor easier spread of COVID as more activities move indoors and more people travel and gather to celebrate the holidays, it remains important for all of us to add on those additional layers of protection, including masking up indoors and in crowded outdoor spaces. This is also the time before the holidays and before cooler weather leads to a rise in viral transmission for unvaccinated people to come on in and get your vaccines. And for those people eligible for boosters, please come in and get your additional dose. One shared priority for all of us across the county is making sure that our children can attend in-person classes and participate in those very essential school-based activities. We continue to closely follow cases at schools, most of which are diagnosed through routine screening of asymptomatic people, which identifies many infected people who would not ordinarily be detected. While we anticipate that the ability to vaccinate all school-age children will provide the best protection, the continued efforts of our school communities, including all of you, parents, students, teachers, and staff, show that masking and other preventive measures are also very powerful tools for supporting safety at schools. Last week, we saw about 500 student cases and about 2,700 student close contacts. Among staff, there were about 80 cases and 120 close contacts. These numbers represent a 40% decline in student cases and a 43% decline in staff cases from the prior week. Given that we have more than 1.7 million children and staff attending or working at over 3,000 schools countywide, these are strikingly low numbers. This amounts to a test positivity of 0.2% among students and staff, with a 0.2% of people that have been identified as close contacts. These low numbers are the outcome of tremendous efforts on the part of our school communities to adhere to strategies that protect students and staff, and we're all grateful for this hard work. We have received hundreds of questions, and while we won't get to all of them tonight, we're going to do our very best to answer as many as possible. We hope that by sharing important information and answering your questions, we can continue our work together to protect our loved ones, our county colleagues, and our communities. Before I go to our panelists, I'm mindful that Halloween is this weekend, and I know that residents of all ages are looking forward to celebrating the holiday. Fortunately, there are lots of safe ways to have fun when celebrating Halloween, including outdoor costume parties, pumpkin patch visits, outdoor ghost tours, hay rides, and trick-or-treating, all that can be done safely. These options are much safer than doing things indoors. When deciding what activities to take part in, it can be helpful to think about what is it that makes the activity safe. The more participants who are vaccinated, the less likely an activity will result in viral transmission. Additionally, being outside adds safety, and you can further reduce risk by masking up when around people outside your household and avoiding those very crowded situations. Handing out individually packaged treats also makes transmission much less likely. Taking a common sense approach to the holiday can limit risks while maximizing fun for everyone. But the best thing you can do to protect yourself and others on Halloween and as we approach all of our fall and winter holidays is to get vaccinated if you or your family are eligible for a COVID-19 vaccine. Please make it a priority to go get your vaccinations or to get your boosters as soon as you can. This will provide extra protection while celebrating all of the joyous times we want to have together over the holiday season. And it's also an opportunity for many of you to get vaccinated against the flu as well, since many sites will offer you both a COVID vaccine and a flu vaccine, and it is safe and appropriate to get both vaccines at the same time. Now I'm going to turn it over to Dr. Davis to talk more about COVID-19 and our vaccination efforts.
Thank you, Dr. Ferrer, and thank you to everyone for being here and listening in. And as Dr. Ferrer mentioned, it's safe to get both the flu vaccine and the COVID booster if you're going to do that. I'm actually one of those people that did that at the same time. It was a few days ago. I'm fine. So it's not a bad thing. Okay. So let me just talk a little bit about COVID and just remind everyone that what we know about COVID really in terms of how it spread has not changed. COVID-19 still spreads from person to person, mainly through respiratory droplets that are released into the air by a person who has COVID-19. For example, when they speak, sing, cough, shout, sneeze, or breathe heavily, this is how droplets can then be spread as they breathe out. They can be breathed in by other people or land on the eyes, ears, or nose or mouth of the person who's next to them. And, a person's risk of getting infected goes up the closer they are to someone with COVID-19. Enclosed places with poor airflow can also increase the risk of getting infected. This is because the droplets that have the virus can concentrate and spread in the air past 6 feet. They can even stay floating in the air after an infected person has left the room. While there are many ways to prevent the spread, vaccines remain our most powerful tool in preventing serious illness and death from COVID-19. To date, more than 13 million doses of COVID-19 vaccines have been administered here in Los Angeles County, and we continue to vaccinate people every day at more than 1,000 locations. The COVID-19 vaccines continue to be safe and effective for persons 12 years and older. And recently, and as Dr. Ferrer mentioned, and Dr. Yagana will talk about, the FDA is close to approving the Pfizer vaccine for children ages 5 to 11. These vaccines were developed using technology that's been around for many years by a number of scientists in partnership with the government and organizations all over the world. Tens of thousands of people participated in the trials with all different ages and ethnicities. Once the vaccine was created and the trial began, a robust tracking system for outcomes, reactions, and data collection was set up. This system is used by public health departments and hundreds of organizations all over the country. The CDC and FDA continue to closely monitor the reporting system, which looks for any safety issues now that vaccines are being given to patients in real-world settings across the United States. With more than 416 million doses of vaccine given in the United States, the COVID vaccines have the most intensive monitoring system in U.S. history to ensure they are safe. All of that being said, there are still many people who are unvaccinated, and they should be aware that they are at high risk for not only contracting COVID-19, but of having severe outcome and long-term health effects if infected. Unvaccinated individuals continue to make up the majority of those hospitalized for COVID-19 here in Los Angeles County. Unvaccinated people need to be particularly careful and should avoid high-risk activities, wear their mask, and consider wearing a respirator, an N95 mask as an example, if their job or any activity requires that they are in close contact with others. We monitor outcomes among fully vaccinated people to better understand the level of protection vaccines provide and to track post-vaccination infections. Of the more than 5.8 million LA County residents who are now fully vaccinated, approximately 66,000 fully vaccinated people who tested positive for COVID-19 as of October 26, 2021. In all, about 1.1% of fully vaccinated people in LA County have tested positive for COVID-19 after being fully vaccinated. Of those who tested positive, about 2,200 people were hospitalized, which translates to 0.04% of all fully vaccinated people who are infected ending up hospitalized. There have been 343 deaths in this group, translating to 0.006% of fully vaccinated people passing away from this infection. All the information we have, including these numbers, signifies that the vaccine continues to offer powerful protection against the most severe outcomes of infection with this virus. As of October 24th, 94% of LA County residents 65 years and over have received at least one dose of the vaccine, as have 80% of residents 12 years and over. 72% of residents 12 years and over are fully vaccinated in LA County. 72% of LA County teens between the ages of 12 and 17 received at least one dose, and 63% are fully vaccinated. Out of all the nearly 10.3 million LA County residents, including those who are not yet eligible for the vaccine, 69% have received at least one dose, and 61% are fully vaccinated. So far, nearly 425,000 additional or booster doses have been administered in LA County. Booster doses are now available to certain people who received their second doses of Pfizer or Moderna vaccines at least 6 months ago, and to those who received a Johnson & Johnson vaccine at least 2 months ago. Ultimately, the goal is to prevent as many serious illnesses and deaths as possible. The burden of being unvaccinated continues to be borne unequally by different age groups and by racial and ethnic subgroups. The subgroups with the lowest vaccinations proportions are all among our Black and Latino communities. Although the inequities in healthcare access and trust that underlie these gaps are centuries old, the threat of these low numbers poses a very present. The people who stand to be hurt by the winter surge are those in the Black and brown communities that have already lost the most during this pandemic. Many of us who are already vaccinated can help close the gap by sharing our stories and providing support to those who remain fearful about the safety of the COVID-19 vaccines. Folks who are already speaking up about the importance of getting vaccinated are doing so because they've seen what a difference it made to them and those they love to feel safer as they move through the world during the pandemic. If you've been vaccinated, you made a decision after determining the benefits of the vaccine that those outweighed any risk, and we encourage you to share that information with others to help them make the decisions that can keep themselves and their loved ones safe. If you still need to get vaccinated, public health can help. There are vaccination sites across our county, and you can find one near you at vaccinatelacounty.com or at vacunatelosangeles.com. Thank you. Now I'll turn it over to Dr. Sarah Kurian to discuss boosters.
Good afternoon, and thank you, Dr. Davis. As mentioned before, boosters are now available to residents in LA County. It's important to know when and if you are eligible for a booster dose. So I want to take a minute to break down the eligibility requirements because it varies depending on which vaccine you received. First, for people who received the Johnson & Johnson COVID-19 vaccine, booster shots are recommended for everyone who was vaccinated 2 or more months ago. And then LA County residents eligible for a booster dose of Pfizer or Moderna COVID-19 vaccine include those who received the second of the two-dose vaccine series at least 6 months ago and are 65 years and older, or they're 18 and older and live in a long-term care setting, or they're 18 and older and have an underlying medical condition, or are 18 and older and work or live in a high-risk setting. Now, one of the questions we get quite often is, what are those high-risk settings? And so examples of these high-risk institutional settings include healthcare, schools, group homes, prisons, and shelters. And the CDC currently defines occupations at increased risk for COVID-19 as first responders, and this includes healthcare workers, firefighters, police, congregate care staff. It also, another occupation is education staff. So this includes teachers, school staff, daycare workers, food and agricultural workers are also included, as are manufacturing workers, those working in correctional facilities, US Postal Service workers, public transit, and grocery store workers. Now, what's interesting about the FDA and CDC's decision is that all eligible individuals are now allowed to choose a different brand from their original vaccine as a booster. So if you got a Johnson & Johnson vaccine, say 3 months ago, you are eligible for a booster and you can get Pfizer or Moderna in addition, or you can stick with Johnson & Johnson. And if you got a Pfizer vaccine, you can get Moderna or Johnson & Johnson as your booster if you'd like. This is what we call mix and match. And part of the reason why boosters are so important is that they provide increased protection when there is increased transmission or variants that are spread more easily. Delta still does account for about 100% of all variants reported to us as we continue to monitor other variants such as the Mu and Lambda variants among both our new and historic samples. So we really encourage those who are eligible to make an appointment to get their booster doses at vaccinatelacounty.com. Thank you. And now I'll turn it over to Dr. Yagena to talk about vaccinating children.
Thank you so much, Dr. Kurian. As many of you know, serious illness and death due to COVID-19 is thankfully less common in children than in adults. It is less common, but it does happen. Recent evidence has also shown that in the era of Delta, even if the overall risk for severe disease remains low, children's risk of getting infected and spreading the virus appears similar to that of adults. And if they do get sick, they can experience symptoms that last for days, weeks, or longer. 1 to 2% of more than 5.7 million children in the United States who've been diagnosed with COVID-19 have been hospitalized, and more than 600 who are under the age of 18 have died. In Los Angeles County, children 5 to 11 years of age currently comprise 6% of all the infections. As the families of children who have been hospitalized or have suffered other severe outcomes of this virus can tell you, safely preventing COVID-19 infection has enormous value. Furthermore, thousands of children have missed school and other important developmental activities because of being in isolation and/or quarantine due to being infected or exposed to COVID-19. These absences can create major learning disruptions, and the vaccine continues to be our most powerful tool in mitigating transmission of COVID-19 in school, in sports, and other important childhood activities. I think also importantly, children don't live alone. Children interact with parents, grandparents, aunts, uncles, and one of the most important outcomes from protecting children from getting infected is also preventing transmission to the people with whom they share a home. As the holiday season is approaching, vaccinating your child can add to the safety of the family gatherings, where large groups of people might want to spend time together. So earlier this week, the Food and Drug Administration's Vaccines and Related Biological Products Advisory Committee reviewed Pfizer's data describing the results of their clinical trials in this age group of 5 to 11-year-olds. They were looking specifically at safety and efficacy of the vaccine. They had over 2,000 children who had received vaccine versus 750 children who received placebo. Their data showed that the vaccine was 91% effective at preventing COVID-19 infection in children who are 5 to 11 years of age, and there were no serious adverse events reported. Based on the discussion, the committee then unanimously recommended that the benefits of receiving the Pfizer-BioNTech COVID-19 vaccine outweighed the risk for use in children who are 5 to 11 years of age. Next week, on November 2nd and 3rd, the CDC's Advisory Committee on Immunization Practices will also review the data and vote on the final recommendations. The CDC director will then finalize and issue clinical recommendations for use of this authorized vaccine in children 5 to 11 years of age. We estimate that there are hundreds of providers in Los Angeles County ready to provide vaccine to children in this age group as soon as the CDC issues its final recommendations. We are positioned to have almost 150,000 pediatric doses of Pfizer vaccine available next week. They will be at the providers' offices and clinics that have agreed to vaccinate children and are approved to vaccinate children. On Monday, we will post a map on our website that people will be able to click on to find a pediatric vaccination site near them. So far, many pharmacies have indicated they would be willing to offer the vaccine to 5 to 11-year-olds. We'll also be offering it at all our county sites, our mobile sites, and school sites countywide. Of course, parents and children caregivers can also check in with their children's pediatrician, as many pediatricians will also be administering the vaccine once there's final approval from the CDC. Now, many people will still have a lot of questions about whether the vaccine will be the right choice for their child. If you have these concerns, we urge you to speak to your child's medical care provider, to check the CDC website and the LA County Department of Public Health website for updated information. I know that we are all focused on keeping our children safe in order to keep all of us safe and to give us a path forward to recovery. Thank you. And now I'd like to hand it over to Gemma Morales, Mayor.
Good evening, and thank you, Dr. Yegane. It's nice to be with all of you tonight. I would like to take a couple of minutes to detail how you can get your boosters and when the time comes, get your children vaccinated.
Emma, I just want to pause for a second because you're not coming in loudly, so let's just make sure we can get your sound up.
Sure, let me know if this is better.
Maybe talk louder.
Okay, good evening, everyone. It's nice to be with all of you tonight. Is that better?
Much better, perfect. Thank you.
No problem. I would like to take a couple of minutes to detail how you can get your boosters and when the time comes, get your children vaccinated. While you don't need an appointment at many places to get a first, second, or third dose, it is very easy to make an appointment for a booster dose. You can go to myturn.ca.gov or to our website at vaccinatelcounty.com to make an appointment and for more information about booster shots. You can get vaccinated at any of our 344 mobile sites or our more than 1,300 fixed sites countywide. And if you need assistance in making an appointment, you can call 833-540-0473 and someone will assist you. Additionally, my apologies. Many pharmacies and clinics countywide may be accepting appointments through their own systems. If the place where you got your primary vaccine series was convenient for you, you can check back with them now to see if they are offering booster doses. All you need to bring with you to your appointment is proof of your primary vaccine series, such as your white vaccination card, a photo of your vaccination card, a medical record, which are the documents that show that you have received these vaccines, or your digital vaccine record. Also, you can safely get your first, second, or third COVID vaccine at the same time you receive other vaccines, including your flu shot. The best schedule for getting both of these vaccines is the one that doesn't delay either of them. All of the county DPH sites and most pharmacies are offering both COVID and flu vaccinations. And for children, an enormous network of providers countywide is scaling up to provide vaccines to children between the ages of 5 and 11. Approved providers include pharmacies, federally qualified health centers, county sites, pediatricians, and family medicine practices and clinics. There are several areas in the San Fernando Valley, Antelope Valley, and South Central Los Angeles where the number of providers is not well matched to the number of children who will be eligible for vaccinations. In these areas, our mobile vaccination teams will supplement vaccinations offered by existing providers so that children have easy access to our most powerful protection from COVID. We will share a map of confirmed providers of COVID vaccines for children aged 5 to 11 the week of November 1st. School vaccination sites form another pillar in our vaccination plan. Many parents have requested that we offer vaccines to children and teens at schools because these are familiar and trusted places. School vaccination clinics have already been an important part of our community vaccination strategy. As of October 5th, we have collaborated with school districts to hold more than 800 school-located vaccine clinics. Over the course of the month of November, we will be offering vaccines at school-based events with a focus on schools in Compton, Antelope Valley, Lancaster, Norwalk, Glendale, and Pomona. We are currently planning more than 330 school-based vaccination events across the county. That number will increase as more school districts are partnering with healthcare providers to set up clinics in November and December. To get vaccinated, a consent form signed by their parent or legal guardian is required for all children ages 5 to 7 years old. Parents may or may not need to be present, so it's important to check with the site for their requirements. Thank you, and now I'd like to turn it back over to Dr. Ferrer so we can begin answering questions.
Yeah, thank you so much, Hema, and to the entire team. We do have a ton of questions, so I'm going to just get started immediately with a question. Maybe Dr. Davis, we can start with you. This is a great question. Why does immunity wane after the vaccines? We had been led to believe that we only needed to get vaccinated the one time if we got our 2 doses a few weeks apart. Why now are you telling us we might need to get a booster?
Well, this is actually fairly common. If you think about a lot of the vaccines that are out there, there are some that last a much longer period of time. Again, we're dealing with a new virus and also are dealing with a new infection. And so we had to see, how this would actually last. But this is, I would liken this to, something like tetanus boosters or influenza vaccinations, where they're protective for a certain amount of time, and then you may need to get another one in order to have that same level of protection. So as the providers and the scientists sort of watched and saw when it looked like the immunity was waning, they instituted boosters in order for that to happen. But this is something that's fairly common. The vaccinations provide a good level of protection. Many of them do so for years, sometimes for decades, and others may have to be more frequently. But this is something that is not uncommon that we've seen with other vaccines.
Thank you so much, Dr. Davis. Dr. Yagane, why would children need more than one shot of the vaccine like adults? Because they're so much smaller, why can't they just get 1 dose?
Yeah, that's a great question. So they have changed the formulation for the younger children, the 5 to 11-year-olds. We always say that we're not giving the vaccine per weight, we're giving it per the immune system. So children are not little adults. They have a really robust immune response. And so the vaccine dose is actually different than the dose that we're giving to the older kids and the adults for Pfizer BioNTech. They have studied it in, like I mentioned, a trial involving thousands of children, and they found that the dose that they're using is effective and that it would require 2 different doses, just like we mentioned. So you would get the first dose, and then 21 days later, you would get the second dose. And that seems to, that combination of the lower dose and still giving the 2 doses seems to really help get the immune system up and revved and ready to fight coronavirus. I also just want to say that there's no booster recommendation for the pediatric population. Anyone who is, the 12 to 17-year-olds. So the boosters are only right now approved for the adult population. So as of now, only 2 doses of the Pfizer vaccine are approved.
Yeah, I think that's so important for parents to understand that, again, we're lucky in this country and in many places in the world where we have a lot of scientists and researchers that can continue to track, how well our vaccines are protecting us. because that's really the most important information we all need to have is the protections are there when we get vaccinated. If there's going to be some waning, then we're lucky that we can rely on researchers and scientists to tell us when it might be appropriate, as they have done now for adults, to go ahead and get boosted. I'm going to turn to Dr. Kurian. Again, so many questions about the boosters. But why is the J&J booster available at 2 months and Pfizer and Moderna boosters you need to wait 6 months?
Yeah, it's a really good question, and I think you sort of alluded to a little bit about that, about the fact that all of this is sort of based on the data that we have and that the scientists are looking at, and it's based on sort of the effectiveness of the vaccine, and then the clinical trial data that's used to evaluate when effective boosting really occurs. And when they looked at the J&J vaccine, what they found was that at 2 months after the initial dose, when a booster dose was administered, they were seeing anywhere on the order of like 93 to 94% effectiveness in protecting against moderate to severe disease. So it really made sense to really provide a booster dose at 2 months for J&J. There was some limited data that looked at, boosters at 6 months after initial dose of J&J, but it's extremely limited. It wasn't really sufficient enough to make a recommendation based on. So similarly, when they did Pfizer Moderna trials and they looked at boosting at 6 months, they found really effective protection at that 6 month period of time. So these determinations are all based on scientific data that are done through these clinical trials that continue to monitor safety and effectiveness of the vaccine.
Thanks so much, Dr. Kurian. Ms. Morales-Myers, I wonder, because I know there was so much information you provided, but we do have a few questions. Just if you wouldn't mind going over again, what does a parent need to bring with them to get a child between the ages of 5 and 11 vaccinated? And what should they be prepared for in terms of coming back for that second dose?
Sure. So children will need to have a consent form signed by their parents. Now, some sites may require that the parent be present and some sites may not. So it's best to make sure to check with the site for their requirements. You should, for their second dose, you should expect to bring back their vaccination card or proof that they received their first vaccine so that they can get their second dose. When they're going in. And same thing, a consent will be required at that time. And definitely check with the site to make sure about whether the parent needs to be present or not.
Yeah, I think it's really helpful for parents to also know that because this is Pfizer, you do need to make sure you're planning ahead because you want your child to get that second dose about 3 weeks later. It doesn't have to be exactly 3 weeks. We get a lot of questions. What if, especially if you got vaccinated, for example, on the 4th, 3 weeks later is going to fall on the Thanksgiving holiday. We tell parents, please don't worry. You can be a couple of days late. You can be a day or two early. The important thing is that you're planning ahead and you know that they need that second dose. This vaccine for children does require the first dose and then 3 weeks later, around 3 weeks later, that second dose. I think that's just important for everyone to keep in mind. And again, many sites are very accommodating. For some parents, you might not be able to come. You can sign a consent form, send your child with a supervising adult, and you'll be able to get that child vaccinated as long as there's a signed consent form. Other sites may prefer that you as a parent come. So I think Ms. Morales-Myers was accurate in saying, again, be prepared, call ahead of time, find out what will be required at a specific site. We can tell you at the county sites, you can bring your child or you can send your child with a supervising adult and a consent form. But you will need to, as a parent, be able to grant that consent. I'm going to turn back, Dr. Davis, because again, so many questions, particularly about children and why they should get vaccinated. So maybe we can start with this. Since there's low transmission in LA County, why should my child get the vaccine? I'm nervous that it's so new. Before I ask Dr. Davis to respond, I do want to note we do not have low transmission here in LA County. We actually have tons of transmission. I know we're all relieved we're not in the middle of surge, but our numbers are about double what they were back in June when we were in much lower transmission. So please help us get to lower transmission by getting vaccinated, taking safety precautions. But I think it's a good question about when, because there's not as much transmission and because children don't seem at as high risk as adults, why should parents go ahead and get them vaccinated, particularly get them vaccinated now?
Yeah, I appreciate that question. And I was going to say the same thing. We're definitely not in low transmission at this time. However, I do want to point out that, the viruses go from person to person. Whether transmission is low or transmission is high, any person that is not vaccinated is at risk, higher risk of getting infected. And that's what we're seeing even now. And definitely at higher risk of having serious outcomes if infected. So really, it's about each of us protecting each other, not only the person who gets vaccinated, protecting themselves, but then protecting others around them who might also not be able to get vaccinated for whatever reasons they may have. But in general, the idea is that the vaccines are the safest and most effective at preventing infection, preventing serious outcomes from infection if someone is infected. And so the less people we have at risk of being infected, the less this virus will transmit within our communities. So it's really important that each of us do our best to get vaccinated if we can. It just protects not only us, but it protects everyone around us in our communities.
Yeah, thanks so much, Dr. Davis. I'm going to just stay for a couple of minutes on vaccinating children because we have a lot of questions here. And maybe, Dr. Yagane, I can switch over to you. I've heard that there can be side effects developing heart problems due to the Pfizer vaccine. Are there some children that are more at risk for developing heart problems, or are all children at risk of developing heart problems from the vaccine?
Yeah, that's a wonderful question. And I think really, again, an area of intense interest, myocarditis, or that inflammation of the heart, was discussed at great length during the FDA meeting. Just as a background, myocarditis isn't a single condition. It can be caused by infection. It could also stem from other causes like autoimmune disease or medications. Traditional myocarditis seems somewhat different than the one that we're seeing caused by the vaccine. We also know COVID-19 can cause myocarditis because it is a virus that can affect the heart. There's also that post-infectious inflammatory syndrome called multi-system inflammatory syndrome in children. About 5 to 10% of individuals who have MIS-C, they can have myocarditis as well, and that tends to be more severe, and several of them have to be in the ICU. For the myocarditis caused by the vaccine, this seems to be a thankfully rare event. It occurs, and they didn't have any occurrences in the trials for the 5 to 11-year-olds, but in the older categories, it occurs in about 30 to 40 individuals per million who received the vaccine. So the dosage is being lowered for the 5 to 11-year-olds, and the idea is that that might affect the incidence. So hopefully we would have a lower incidence in this age category. That being said, that is something that is being intensely studied to see if there's anything that we can do to predict who would have myocarditis. Maybe there's some sort of profile of some sort of genetic marker where we can identify individuals who might have this really rare outcome. Thankfully, the individuals who have had myocarditis from the vaccine, most of them have been able to recover relatively quickly. And now we're gathering information and follow-up to make sure that they continue to do well. In general, their characteristics seems to be that they recover smoothly. Their hearts are still pumping normal amounts of blood. They seem to be able to engage in normal activities again. But it is a rare and serious event, and I think that there's going to be more information gathered.
It might be helpful, Nava, if you also can talk about the fact that children who experience COVID disease also develop myocarditis at actually a much higher rate.
Yeah. No, and I think that just like Dr. Ferrer said, this rare but serious event that happens with vaccination, it affects about 30 to 40 per million in individuals. So it's like a 0.00, 3% risk. It's very low. In individuals who have COVID-19, especially, young adults, the risk of myocarditis is closer to, it's less than 1%, but it's still, much more frequent. And then for people who get MIS-C, or the multi-system inflammatory syndrome in children, the risk goes up to 5 to 10%. So it is definitely much more common with disease. And again, it's very common with that syndrome that we see in children, specifically the multi-system inflammatory disease in children. So that is one of the hallmarks, is myocarditis. So these are all different ways that the virus affects children's hearts. And in comparison, the vaccine is much more. It's a much more rare event with the vaccine.
Yeah, thanks so much. We have a couple of questions about which vaccine should you give your child. So I'm just going to answer those before we move on to another set, which is the only vaccine that you can give your child between 5 and 17 is in fact the Pfizer vaccine. So unlike adults who we can pick whether we want the Pfizer brand, whether we want Moderna, or whether we want Johnson & Johnson, for children 5 to 17, there is only one approved vaccine by the FDA. And again, we have to wait for final approval for the children 5 to 11, but it is likely to just be the Pfizer vaccine. That is all that got reviewed at the FDA advisory committee meeting. And those are the recommendations are really only being made for administering a Pfizer vaccine to children. So there's no pick and choose when it comes to vaccinating children, should this vaccine be approved by CDC next week. I'm going to switch back. One more question, actually, maybe Ms. Morales Myers, you could help with this is, and again, I know we talked about this, but there's a whole bunch of questions on when exactly can my child get that vaccine. I'm in a rush, actually. I've been waiting and waiting. I have 2 younger children. Everybody else in my family is vaccinated. I want my younger children to get vaccinated as soon as possible. When and where are those doses going to be in the county? When can I expect that I might be able to get my child, my 2 children who are between 5 and 11, vaccinated?
That's a great question. We do expect that the CDC advisory panel will vote on November 2nd, and then CDC will make a recommendation after the vote. So it could be likely that providers may start giving doses as soon as November 3rd. This is all pending approval, but we're optimistic that that will be the date.
And then here in the county, we're going to be ready to go. So, we'll have well over 100,000 doses here by November 3rd, pediatric doses. So those of you who have been waiting anxiously to get your doses, we do have to wait for that full approval, but there will be hundreds of places you can go in the county to get children vaccinated once we have that full approval, and we'll already have received doses in the county according to the federal government. We've been able to pre-order, and we anticipate those doses coming in before the 3rd of November. So we'll have doses here, and again, go online, vacunatelosangeles.com, or go to vaccinatelacounty.com, and you'll be able to see a map of where all the places are that'll be administering pediatric doses. That map will be up by Monday of next week, so you'll be able to get good information. I want to go to Dr. Kurian, and just because I want to go back to boosters. Sorry, we're going to be switching back and forth tonight between boosters, and obviously tons of questions about boosters, tons of questions about vaccinating younger children. There's a question. I got Pfizer earlier this year, and I'm eligible for a booster. Should I get Pfizer again, or is Moderna better, or should I be switching to J&J?
Really good question. And the great news is the current recommendations really allow for what we call mixing and matching of the booster dose. So if you've received a Pfizer primary series and you belong to a group for whom a booster is recommended, you can actually receive either the Pfizer, Moderna, or even the J&J vaccine as your booster dose. And if you're confused about, what option might really be the best for you, definitely speak with your healthcare provider. But any of these combinations are allowed. Some folks have used, some of the really extremely rare adverse events that have been associated with the vaccine, such as like the blood clots with J&J vaccine that we're seeing in women younger than 50, or Guillain-Barré in men over the age of 50, or myocarditis and pericarditis in teenagers, or young adult men that we're seeing with the mRNA vaccines is sort of like a guide as to which one they might want to pick if they belong to one of those groups and want to avoid, the rare potential of one of those outcomes. But again, none of those are, restrictions that are applied. Folks do have the option of choosing any of the 3 available vaccines. Again, the things to kind of pay attention to is, with the mRNA vaccines, do you belong to one of the recommended groups for which a booster is recommended, or and then for J&J, it's really anybody. If you had a J&J primary series, if you're over the age of 18, which you would be anyways, if you would have had to be 18 and over to get J&J in the first place, you can pick and choose any of the 3 available options.
Thanks so much, Dr. Corrine. I'm going to just ask, sort of one additional question about the boosters, if you could help us with this, because again, I think it's super important. When we say that people are eligible if they live or work in a high-risk setting, does this include multi-generational homes or homes where vulnerable individuals live? I don't see that laid out, but I know that in my household, there are older people at much higher risk. Is this considered a high-risk setting, and should we all be getting our boosters if we're eligible?
So yes, anybody who's eligible absolutely is recommended that they go out and get boosters, and especially for those people who might be living in your household who are, vulnerable or meet, age criteria. And again, for anybody who received a J&J vaccine, they are, everyone's recommended to go out and get a booster 2 months after they receive that J&J vaccine. So absolutely, if you're eligible, the recommendation is to go out and get the booster. But in terms of what they mean by high risk setting, what's currently recommended is adults who work or reside in certain settings, and this includes places like healthcare, schools, correctional facilities, and homeless shelters. So those are the sort of settings that they refer to when they talk about high risk, and that's really because folks that are in those settings can be at increased risk of being exposed to COVID-19 just by the nature of the work that they're doing and who they're working, around, and just the fact that they're working around a lot of different people. And it also it places them at increased risk because, depending on sort of the spread of COVID in the community, which again, as we've alluded to many times on the call today, although we see our case numbers dropping, it's, we're not in low transmission. We are still having COVID in our communities. So, again, the focus is really on folks that are like first responders, education staff, food and ag workers, manufacturing, corrections, public transit, grocery store. Those type of individuals are the folks that we consider to be in high-risk settings and should go out and get boosted. But there is a little asterisk, of course, that they put on the CDC website about like these high-risk settings, which means that they're continuing to look at the data, and recommendations around what qualifies as high-risk may evolve. So stay tuned.
Yeah, and I think we have a ton of questions about this, like who really should be getting a booster. So I just want to note that there are some people who it's really important they get a booster because because there's some waning protection from the vaccines, and if they were to get sick, they could get very serious and severe illness. So these are people who are 65 and older, people with serious underlying health conditions. So whether you got your first dose Johnson & Johnson, or you got 2 doses of Moderna, or you got 2 doses of Pfizer, you're 6 months out. If you got Pfizer or Moderna, you're 2 months out from J&J. If you're in this higher risk category, there is evidence that the vaccines aren't offering as much protection as they originally did. So please, let's not go into the holiday season without taking advantage of making sure you're getting your boosters. And then there are a whole bunch of people who should assess their risks if they received a Pfizer or Moderna dose more than 6 months, their second dose more than 6 months ago. And that includes all those people that Dr. Kurian just mentioned. They're working in high-risk settings. They live in a high-risk setting. And the definition is broad. And I love that this question, because I think this came from somebody who is saying, I think my home is a high-risk setting. I don't think that's what everybody is thinking about, but I live with people who would be very vulnerable. And I talk to people who tell me that all the time. I take care of my parents. They're 90 years old. They're going to get boosted, but it's my turn to get boosted as well. Like, I'm past my 6 months for Moderna, or I'm past my 2 months for Johnson & Johnson. Should I consider myself as a person who would benefit from a booster? And we tell people, you know what? This is the time for you to weigh those risks and make a decision that works for you and your family. But absolutely nobody wants to get infected and pass this infection on to somebody who is at higher risk. So we've been given a fair amount of flexibility here for many people who got doses. Again, the most important thing is that your second dose was 6 months out if it's Moderna or Johnson & Johnson. Moderna or Pfizer, or 2 months out if it's Johnson & Johnson. But then the lists of who is eligible are fairly broad. So, please, again, look at your own circumstances. And we're urging people who are eligible for boosters to make sure that they're doing that, again, before the holiday season. We're so lucky in this country that we have access to this additional dose. So please, don't hesitate. And if you have questions, talk to your provider about that. I'm going to go back to Dr. Davis because there are some other questions about indoor masking and indoor masking requirements. We have about 10 of them. So I'm going to try to put them all in one for you, Dr. Davis. When will you drop that mask mandate for vaccinated LA County residents, both indoors and in large outdoor mega events?
So we should go back to why they got put in place in the first place. I do want to remind people that these requirements are sort of layers of protection. Each one adds an additional layer of protection against spread of the virus when people are together. When we first put this in place, we had gone from low transmission to high transmission, substantial and high transmission very quickly. And this was put into place also in the midst of having, which we still do have, a more infectious variant of the virus spreading. When we first put it in place, we talked about revisiting that decision once we got back down to at least moderate transmission. And those are the things that we're looking for. We are not there just yet. And as we get closer and we come to that point, we'll have some more solid understanding as to where we are, both with vaccinations, where things are with our hospitalizations, as well as where we are holding in terms of transmission. So at the moment, given that we still have substantial transmission, we are going to continue to have the masking requirements indoors in order to protect everybody as people are continuing to get together more often, and we don't have physical distancing or requirements or capacity limits. So at this point, given where we are in terms of community transmission, it'll stay there. We'll revisit it once we get down to moderate transmission and we're able to hold there.
Yeah, thanks so much, Dr. Davis. And I think that makes sense. I'm going to stay with you just for a minute because I think there's a couple of other questions just about our health officer orders. And it would be helpful to sort of, be able to answer some of these. What do I do if the bar I work at is letting people inside who are not vaccinated?
Well, if you're asking that question, you know that it's not something that should be, and that is against the requirements that we have in place. I would definitely want to make sure that the managers, owners, understand the requirements that are in place. And know that our inspectors are out there and will be inspecting to see if businesses are adhering to those requirements. However, people can also call and report that things aren't being done the way that they should be done, or that there's a risk and that things aren't being followed. We do have on our website a customer complaint line, a call center line that can be called. It can be anonymous. And that number, it's on our website, which is at publichealth.lacounty.gov. The call center to report complaints is 888-700-9995. Again, 888-700-9995. You can also file a complaint online. There's a link available where you see report a complaint that people can submit one, again, anonymously, but electronically online. And our inspectors will follow up and make sure that the business understands what they need to do and help if they're in confusion in terms of what the requirements are. And we'll follow up to check again to make sure that they're adhering to those requirements. It's really what keeps everybody, not only the workers, but the customers there, safer.
Yeah, thanks so much, Dr. Davis. And just as a reminder, you can report anonymously. So I know particularly for employees, you may, with reason, be worried about reporting something that's not going well at your place of employment, but you are not required to give any personal information in order to file the complaint. So, we urge people again to, work with your employers, work with your co-workers, try to make sure everybody's on the same page. It's super important at bars. Those are really high-risk settings where we do need people to be vaccinated to create a lot of safety. People are oftentimes, for most of the time that they're there, because they're often drinking and eating, are not wearing any face coverings. So there can be a lot of risk when transmission is as high as it is right now. So thanks for asking us that. And I applaud you sort of, trying to do the right thing. We really respect that and hope that you'll, go ahead and report that to us so we can get an inspector out. And again, the way our inspectors work is we go out, we work with the businesses. Almost all businesses come into compliance without needing to get citations. But it's important for us to have that opportunity to educate the businesses and make sure they understand that this is a legal requirement here in LA County. I'm going to flip back now to children. So, Dr. Jagane, if you don't mind getting ready to answer a couple of questions. I think this is a great question that a couple of parents have actually sent in. If my child is 11 and a half, should I wait until they're 12 so that they can receive the full dose vaccine? Or should I vaccinate them right now, knowing that they're going to get a much smaller dose?
Yeah, so I do think that there is going to be more discussion about people who are right about to turn 12 for the ACIP meeting, especially if they're going to turn 12 in the interim between the first dose and the second dose. But in general, I think what's really important to know is that the dose of the vaccine that was studied in the 5 to 11-year-olds is smaller, but it's highly effective. So it does, the children do have a stronger immune system, and so they do have appropriate response to the vaccine. So if it was me in that situation, I would want them to get them protected earlier. So I would give them the appropriate dose for an 11-year-old, and I would just go ahead and get that dose. As far as an individual whose son is, or daughter is 11, and then 3 weeks later they're going to be 12, I think that specific situation will be discussed, and we'll have more clinical guidance for you.
So thanks so much. And again, always check our website. And when things change, we do try to do town halls so that folks have an opportunity to hear from us and also ask questions. Ms. Morales Myers, I do want to switch over to you. Again, a lot of questions about children getting vaccinated, but I think this is such an important question. How do we help children and parents without insurance get the vaccine?
Definitely a great question. Vaccines are free, regardless if anyone has insurance or not. And this is at all sites, including our county sites, our mobile units, our providers. They're also, we can give them to anybody regardless of immigration status. So definitely people should seek out the vaccines at any site, and they are free to any individual.
Thanks so much. I think that's so important. You don't need to worry about needing to show proof of your immigration status. You don't need to be a resident. You could work here and get vaccinated. At this point, we really try to make sure that it's barrier free, including nobody should ever be charged for getting vaccinated. There are sites where you might be asked to show a vaccination card, or show an immunization card, or give information. Show a insurance card, or give information if you have insurance. But if you don't have it, the vaccine's free, and even if you have insurance, the vaccines are free. So please don't let that be a barrier to going in to get vaccinated. All sites need to offer this vaccine for free. I want to also go back to Dr. Kurian and just talk a little bit about the issues of natural immunity. We have a whole host of questions here from parents whose children have already been infected, from family members who have themselves been infected. Lots of people saying, I'm pretty sure I have natural immunity. I got tested for antibodies, like a whole range of issues here. Why do I need the vaccine? And in particular here, why do my children need to get vaccinated?
So yeah, good question. And I know we do hear that a lot. And I think, based on what we know so far, the immunity that we receive from natural infection may not be as stable as immunity that we receive from vaccination. And so the recommendations still stand that in order to really make sure that we provide adequate protection for folks, that you do get vaccinated, even if you've had natural infection. The only caveats being that, you hold off and wait to get vaccinated until you have completed your isolation period. And also there are some caveats around, if you receive certain treatments as part of your treatment for COVID, that you might need to have, some delay in terms of when you get vaccinated. But the recommendations are, pretty much that regardless of whether you've had natural infection or not, that you should go ahead and get vaccinated. And again, it's because the immunity that you receive from vaccination provides you a much more robust and consistent protection than natural immunity alone does.
Thanks so much, Dr. Kurian. Dr. Jagane, I'm going to go back questions again. We have a whole host of questions about this. In a normal event of manufacturing a safe vaccine, trials are usually years long before it's guaranteed safe. With this new COVID vaccine, it was created in under a year with a small trial period. Considering that this vaccine was rushed through everything, why are you rushing to put it into our children? In the past, the earliest vaccines were available was after trials that lasted for 4 years. And anybody can chime in, really. I've directed it.
Sorry, I'm having some muting issues. So I think that's an excellent question. We obviously know that we're all very desperate for a way to get us out of the pandemic. Thousands and thousands of people were dying. This mRNA technology had been studied for years, and there had been vaccine trials that were evaluating mRNA technology for other viruses. The nice thing about the mRNA technology is that it could actually be adapted very quickly to new viruses. So once the virus was sequenced about, almost 2 years ago, they were able to immediately create the vaccine. They did the phase 1 trial. They did it with different doses to make sure they were able to get the appropriate dosage. They did the phase 2 trial where they looked at safety and efficacy. And then they did the phase 3 trial. So they did every single phase that is normally done for any vaccine product. They were just able to do it much quickly quickly, much more quickly, because there was intense interest. There was a lot of scientists who were willing to work on this and spend their time and efforts on this. There were also hundreds of thousands of people who volunteered to be in these trials. And it's the same with children. So when we look at the trials that are done in children, usually recruitment is very difficult. It's hard to convince people to come and get a vaccine and do all the blood draws. But with this vaccine, a lot of parents volunteered their children and said, you know, we want our children to be vaccinated. We want to make sure this vaccine is available. So a lot of it has to do with the amazing work that the scientists had done even before this virus was circulating. A lot of it has to do with how amazing the community was about rolling up their sleeves and joining these big, large trials, looking at the safety and efficacy of the vaccine. So that's how I would think about it, is that it really was a triumph, not only of science, but also of, humanity, and how willing everyone was to participate and making sure these vaccines were done. The trials were done the recruitment for the trials were done so quickly. I also want to say that now we're in our phase 4 trial where we're still collecting data. So individuals who are entered into the trials are still being followed up. They're still filling out diaries. They're still getting their blood checked. So again, we're continuing to do everything possible to really evaluate these vaccines as strenuously as we've ever done for any other vaccines.
Yeah, thanks so much. It's really such an important question. So we appreciate it getting raised because we know, that we all come to this decision, trying to do what's best for our families. And it is hard to understand, how it's going to be possible to have safety in these vaccines when they were developed so much more quickly than what we're used to. But I think it's so important what Dr. Jagane said about the technology that went into developing these vaccines being around for over a decade, and that all of the experience we've had developing treatments and vaccines for other coronaviruses also feed into the work we're doing now. So, the people who work on sort of the vaccine technology, they benefit from all of the accumulated wisdom that we have about how vaccines work in our bodies. And that's been developed, over, really many, many decades now. But I do appreciate that it's a tough decision to make when you are looking carefully at all of the information and wondering, has there been enough study that's been done for us to actually feel pretty confident? And I think Dr. Jagane said it really well, and we're all going to echo that, is, we would not be standing here today recommending that children 5 to 11 get vaccinated, nor would the FDA, nor would perhaps when the CDC meets next week, the CDC meet, if we weren't all looking at data that had us feeling very confident about the safety and the effectiveness of these vaccines. And I personally feel like we're super lucky to live at a time where you can accelerate development so that we don't have, hundreds of thousands more people die of this pandemic because we couldn't get vaccines developed as quickly as we needed them. So, I just know personally, I'm so grateful that we do live in this time where we were able to benefit from years and years of study so that we could move quickly on this vaccine. But we appreciate all of these questions. Dr. I have a question for Ms. Hema Morales Myers. When you say that schools are going to be vaccinating 5 to 11-year-olds, am I going to be allowed to be there with my son?
So definitely a great question. Each site is going to have really their own guidance on what they're going to be doing. In some instances, parents will be allowed to be there. Once again, we mentioned that parent consent is going to be necessary. So you're going to have to give permission in order for your child to receive the vaccine. And so in some cases, the parents will be there. In other cases, they will not. So it's best to check with the school site and ask them to see what their requirements are.
Yeah, we know that most of the school sites we're working with, parents will be welcomed. As a matter of fact, parents can get vaccinated at most of the school sites if they're not yet vaccinated when their children are vaccinated. But please check in. It's just we've been so lucky with the school districts who not only want to make sure that children attending their schools are able to get vaccinated easily, but they want to make sure that parents know that this is a good site where they can get vaccinated, and other community members in most of these sites are going to be welcomed as well. So thanks for raising that. I'm going to go back to Dr. Kurian for a second on what are the consequences of not getting vaccinated?
So that's a good question. Again, as we spoke a lot about, I think tonight, we know we're heading into a holiday season where there is going to be potential for a lot more, situations and circumstances where you might be around other folks. And when you don't have that added protection of the vaccine, you're just at much higher risk of being infected with COVID. And as was also noted earlier on in the call, we know that the highest number of folks that are currently getting hospitalized and having serious outcomes and even dying are folks that never got vaccinated. So your risks are substantially higher for some of these really horrible outcomes that we see with COVID by not getting vaccinated. And of course, say you're young and healthy and, generally at lower risk. If you do choose not to get vaccinated and you do get sick with COVID, you also put other individuals at risk of getting COVID. And those individuals may not be as fortunate, may be at higher risk for getting really sick. So it's really a decision that you make for yourself, but it's also a decision that has impact much more broadly on those around you as well. So the consequences, again, I guess it's important to note, may extend far beyond just what might be there for you.
If I can add, Dr. Ferrer, I think there are also things in place in terms of other businesses that will require you to be vaccinated. So you may not be able to take part either indoors, like at a bar, or in other places, depending on what city you're in. And then there are some employers that are requiring it as well. And so that could mean that you have to do that in order to continue to work there, because they also want to make sure that the workplace is safe for other workers and customers coming in as well. So you have to look at those things and both on the individual side as well as on the social side, and sometimes with work, depending on what the requirements are.
Yeah, Dr. Davis, maybe I can ask you if you can weigh in on another question, which again, I really appreciate that these issues are getting raised tonight. This is from a person who feels that the CDC and others are stating that the vaccine does not prevent transmission or infection. It's not 100% effective. So why would we have all of these mandates requiring healthy adults and healthy children to get vaccinated, which will put them at risk for vaccine side effects when they're unlikely to end up hospitalized from COVID-19?
So it's a great question, and one that we constantly remind people that no vaccine is 100% effective. We have seen, and when these vaccines were first authorized in terms of emergency use, they were authorized to prevent serious illness and death. And at that time, we didn't know whether or not they were actually going to decrease or prevent, infection. But we later did get data to see that the vaccines, and once you are vaccinated, that your risk of being infected is lower, sometimes magnitudes lower than those who are unvaccinated. We've even seen the benefits of being vaccinated for those who were previously infected in terms of those who are unvaccinated and were previously infected being at least 2.5 times more likely to be reinfected with COVID-19 if they were not vaccinated. So there is a lowering of the risk of infection. It is something that has been documented by the CDC. It is something that we see in our own data as we report out in terms of the rates of infection among those who are unvaccinated versus those who are vaccinated. So there is some benefit to being vaccinated.
Yeah, thanks so much. I want to note that we have a set of questions where people have asked, I have a certain genetic disorder. Should I get vaccinated? My father has a heart condition. Should they get vaccinated? My child has a heart condition. We're not going to answer those one by one for the primary reason that for people who have underlying health conditions or worries about whether the vaccine makes sense for them, we are going to always recommend that you talk with your clinical team. That could be a nurse in the practice where you go, or it could be a primary care provider, or for many of you who have rare diseases or rare conditions, it could be the specialty clinic where you're getting your care. We will note that these vaccines are some of the safest vaccines we have ever seen, and that there are very few people for whom a provider would say you should not get vaccinated. There may be some timing issues for some folks, and I think as Dr. Kurian mentioned, for those people who are positive for COVID, we do ask that you wait until you're done with your isolation period and are relatively symptom-free. But in general, these vaccines are safe, and for people with serious underlying health conditions, highly recommended because those serious underlying health conditions are putting you at greater risk. Small number of people that can have an allergic reaction to the ingredients in this vaccine, but that's a very small number. I don't know, Dr. Davis or Dr. Kurian or Dr. Ugane, if you want to weigh in, but we got a lot of questions and I don't want people to feel like we're ignoring it. But in general, when you have some detailed concerns about a health issue that you or your loved one is facing, we like to tell you to, please connect with your healthcare provider.
I'll add that, the CDC has given some pretty extensive clinical guidance for providers in terms of helping to answer these questions as well. And sometimes it's a question of, you have a condition and maybe, let's say, Guillain-Barré, which is an inflammatory disorder that impacts the nerves, may be a risk of that getting Johnson & Johnson, but not with Moderna or Pfizer. And so your providers can help provide that guidance where it may be a precaution, not a contraindication, meaning you can't do it, but a precaution, and here's what you have to look out for, or here's the vaccine that might be better for you, given what your underlying health condition is or are, and what may be a risk, even though a rare risk, from a particular vaccine.
Yeah, thanks so much. And maybe, Dr. Degane, I'm just gonna, because there's a lot of questions about allergies here as well. My child, 9 years old, is allergic to peanuts and tree nuts. I'm concerned about any side effects that a COVID vaccine may cause due to food allergies. Is this something I should worry about? And what are common side effects that we should expect when our children do get vaccinated?
Yeah, so that's a great question. I think that if you're thinking about, severe allergic reactions, if your child does have a history of severe allergic reaction, we have the components of the vaccine. They're widely available by the FDA. There's no food products. There's no latex. There's, a lot of the common allergens are not, there's no egg products. So you can take a look at those and make sure that there's no severe allergic reaction to one of the vaccine components. But if you don't have that, then the recommendation really is to be observed after you get the vaccine. So everyone who gets the vaccine should be observed for 15 minutes. Those with a history of severe allergic reactions, such as anaphylaxis, they need to be observed for a longer period of time. That's what we're doing for the older kids, 12 and above. And so I would think that it will be similar to the 5 to 11-year-olds. We'll find out more when we, when we hear a little bit more from the discussion with the CDC and the Advisory Committee on Immunization Practices. So stay tuned. But I think it's going to be similar, where we'll observe the child for longer and just make sure that there's no severe allergic reaction. In general, our experience has been that people tolerate this vaccine really well, that and anaphylaxis to the vaccine is a thankfully rare event. So I think 1 to 2 per million. So, and sorry, there's a second part of the question. And Forgot.
Oh, about side effects. What are typical side effects that parents should be prepared for when their
Yeah,
child gets vaccinated?
I think the FDA did review that data as well during their meeting on the 26th, and it seems like the side effects are very similar to what adults experience. There's injection site pain. There's some people who have fatigue, muscle aches, for 1 to 2 days. But it seemed like in general, the side effect profiles are very similar to what was seen in the older populations, if not less.
Yeah, thanks so much. And I do want to note that, so many of you have already yourselves gotten vaccinated, so you know about that observation period. Every vaccination site does require people to stay at least 15 minutes. And again, for some people, it gets extended for 30 minutes. So please be prepared. You can get in and out pretty fast, but you cannot sort of eliminate the observation period. That is a safety measure. You're going to find it at all of the sites where there's vaccines being offered. So please be prepared for that. There's a few questions that I think are really important, and we only have a few more minutes, but I'm going to try to get to them because they're about taking care of each other. So I want to, sort of close with the questions about how do we do a good job taking care of each other, because I know that that's top of mind for so many of us. And maybe Dr. Kurian, you could weigh in. I'm planning to travel to Arizona to see my grandparents for Thanksgiving. Is there anything I need to do to keep them safe? Should I quarantine when I get to Scottsdale?
Good question. And yes, heading into the holiday season, I think, we all want to be with our loved ones. And, there's a bunch of things you can do just to kind of like reduce risk for yourself and, of course, for your loved ones. Of course, top of the list is make sure that you're fully vaccinated, especially if you're going to be traveling. Also, check into what the requirements are for the locations that you're traveling to, if they have any specific requirements about things like, mandated vaccination for entry into various different establishments. Make sure that you have your vaccine record with you when you travel. And then when you're, actually visiting with your relatives, again, if they're unvaccinated, you do want to take precautions. Again, making sure that you are masked if you're going to be in any sort of indoor spaces, especially with folks that are unvaccinated, in order to make sure that they are protected. You want to try in general to avoid being in, especially for those people that are unvaccinated, being in places that are sort of close quarters with a lot of folks, again, who might be unvaccinated. So considering sort of your setting and what kind of activities you might be participating in is going to be really critical to making sure that any of your loved ones and yourself remain safe during any activities that you might be sharing with them.
And I'd probably add, we now have a better access, and the president has actually been working a lot on this, and the FDA just recently approved a new antigen, sort of at-home antigen test that you could take. And we can add testing to these layers of protection that are so important. So these are tests that you can take. Some of them are what we call a home test kit. So follow the directions well so that you get an accurate reading. But you can take a test 15 minutes, 20 minutes before you're going to show up somewhere. Make sure that you're not infected. Because we all know you can be without any symptoms and still be infected. And you can even be vaccinated fully and still be infected. So if you're going to a place where there's people that you're going to be with, like elderly grandparents, take those extra steps. Keep your masks on, get yourself tested before you go visit with them. If you've got time to stay in quarantine for a few days before you need to be together, that's also always sensible. But with these rapid antigen tests, you can actually test every day if you needed to. So again, look around. We have community testing sites here. Some of them offer antigen testing, many of them offer PCR testing, but folks can get those results back usually within a day or two. So again, be creative about layering on those protections because there are options and there are tools And the layering allows you to really optimize what you're able to do to protect each other. Another question, again, I'm going to try to, this will probably be our last question, and then we'll go to some closing remarks from our wonderful panelists. I went to a Rams game a few weeks ago. You could substitute Lakers game, you could substitute LAFC game, and not a lot of people were wearing masks. How can I protect myself at the game? Now, as a reminder, at these sites, everyone does need to either show proof that they're fully vaccinated or proof that they've had a negative test result within 72 hours of attending. But also at large outdoor mega events and all indoor events with more than 1,000 people, everyone should stay masked unless they're eating or drinking. But Dr. Davis, I'm going to turn it over to you to sort of strategies for staying protected at these large events.
Well, one is to be fully vaccinated. Definitely, as we've said repeatedly in these sessions, as well as in other information, being fully vaccinated is the best way to protect yourself from serious outcomes if you are infected, and does reduce your risk of infection. The other is to make sure that you are wearing your mask, in those settings, especially when you don't have that distance from others who don't live with you. That will help to reduce your risk, both if you were infected, transmitting to them, and you picking up something from them as well. Also, making sure that you are, making sure your hands are clean, especially when you're going into those common spaces and using those common items that people touch. And if you're eating there, definitely be within your group. And when you take your mask off to eat, put it back up when you've got your food in your mouth and chewing, because there will be others around you without a mask as well. Those things should help reduce your risk. But really, primarily make sure you're fully vaccinated and do those other things as additional layers to protect yourself while you're there.
Yeah, I will add a couple of things also because, I am, as many of you know, I'm a pretty avid sports fan and I do go to some of the games. And so, I have a couple of tips. One is, upgrade your mask. So this is the right time to use a KN95 mask or double layer your mask. And I'll be honest, I don't take my mask off hardly ever when I'm at one of these larger events or I'm at an indoor event that's got a lot of people. I leave it on, and if I need to eat or drink, I'm very picky about where I do that because I do want to keep as much distance between myself and other people. But I know that I, like many of you, long for the days where we're going to go to these events and we're not going to worry and we're not going to need to keep a mask on. But you are so much safer if you do keep that mask on, and if it's a high quality mask, fully covering your nose and mouth. In these crowded situations. So, I strongly, strongly recommend that. So eat before you go, eat after you get home, so that you can, feel like you're pretty comfortable just taking off that mask for very few times while you're with so many other people. And think about your going in and going out, particularly at these large events, 50, 60, 70,000 people. Try not to be in those crowded concourses, indoor areas. Go early, wait a little bit until the crowd thins before you try to leave. Just, being sensible, I think, would allow you to fully enjoy the awesome teams we have here in our county while still being able to protect yourself. And, again, we'll close by saying, those vaccinations really add the most powerful layer of protection. So make sure if you love going to these events that you are getting yourself fully vaccinated. I'm going to ask if either, if we're starting with Ms. Morales Myers, any closing words of wisdom you want to share, and then we'll just see if Dr. Kurian or Dr. Jagane want to add as well.
Sure, thank you. I do want to echo that getting vaccinated is the best protection against COVID-19. And you can go to vaccinatelacounty.com to see all the sites near you that either accept walk-ins or you can choose to make an appointment. You can also call 833-540-7. Let me repeat that again. 833-540-0473 for assistance with making appointments.
Thank you. Dr. Jagane?
I just again want to say thank you so much to everyone. I'm really excited that we're at the precipice of getting more information about the pediatric vaccine product. We obviously don't want any children to die of a vaccine preventable infection, and we don't want them in the ICU. We don't want them in the hospital. We want them at school, doing their youth activities, celebrating the holidays with their family. And we want to do that as safely and as quickly as possible. So I'm very excited to get more information and hopefully availability of the pediatric vaccine product. Thank you.
Thank you. Dr. Korean, I'll let you close us out.
Well, thank you. And, just appreciate everyone joining us tonight and asking such really important questions. And, just as was mentioned, we're in a very, very fortunate state. Place in the sense that we do have access to boosters. We have access to vaccine. We're about to get access to vaccine for our children. So, if you fall into criteria that allows you to receive any of this, please take advantage of it so that we can enjoy the holidays with our loved ones. And happy holidays, everyone.
Thank you. And with that, we wish you all well, and we'll be speaking with you, I'm sure, next month. Thanks so much for everything you're doing to keep each other safe.